What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, a flu test, or a test for some other virus, I hope you have tested negative. If you did test positive for COVID, flu, or any of the viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, May 8th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. There's always somewhere in this world where a virus is making people sick or a virus is rising. We're about to head into the summertime here in the United States. We're in the spring lull for COVID. Other parts of the world are rising. We're going to talk about some of those places today. Want to stay informed with what's going on with all the different viruses? Subscribe to my channel down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. Alrighty, we do have several news stories to talk about today. Several things on the global front today in terms of COVID. Then we're going to take a look at some new data here in the United States, a few different things, and we will probably end the day on wastewater because we need to revisit a couple things and take a look at a few new things over on wastewater. Starting off with Taiwan. I got asked about this yesterday, and seems to be right when I got asked about it, there happened to be a new update about it. And it's not a good update. It's one of two bad updates out of that particular area, well, around the world, we should say. Coronavirus weekly COVID-19 cases in Taiwan surged 78%. Yes, and you're probably thinking, oh, well, that's up from a small number. You know how sometimes I say, oh, don't be alarmed when you see it say such a high percent. In this case, it really is not a good thing. In fact, they are seeing nearly 6,000 cases this week, which is a big increase. Nearly 6,000 individuals sought medical treatment for COVID-19 last week, marking a 78% increase from the previous week and the fourth consecutive weekly rise in cases, the Centers for Disease Control said on Tuesday. So it looks like this update may be from Tuesday. A total of 5,853 outpatient and emergency visits due to COVID-19 were reported across Taiwan from April 27th to May 3rd. I don't know if that includes every case that was counted there. Is at-home testing a thing there? Are some people not testing? I don't know. But the point here being is there's a lot of people that thought they need to go to the emergency room and were released, or whatever the case may be, for COVID. Yeah, it's a big number. And it says, while last week's case count was only 30% of the 19,334 visits recorded during the same period in 2024, it looks like that number is going to continue to rise. And I'm not seeing which variant, but it is possible that new NB, I know I'm going to get it wrong, NB 1.8.1, is it? I should really write it down. I believe that could potentially be the cause. We'll see here. I'm going to be on the lookout. Also, there is now this. Thailand is reporting 8,446 cases reported between April 27th and May 3rd. Just to put in perspective how big these numbers are, it's bigger than the numbers you're going to see from the UK today. And the UK also has the big problem with the at-home testing. A lot of cases not getting reported. But this is from Dennis, the COVID guy. He tweeted this out. And he also put, most patients, this is probably extra from the article. We're not going to click on the whole article. This pretty much shows what you need to see here. Look at this. Most patients were aged 30 to 39 years old with 1,794 cases, with rising cases in children. Never a good thing. Of 0 to 4 years old, 682 cases there. Symptomatic individuals are twice as likely to have COVID over flu, with a 67% estimated chance of infection. And it does say in the article, COVID cases right now do outnumber flu cases in that area. I probably will be doing another thread today on the news stories. It probably won't be out until late tonight, but there'll be a thread over on my website. We did one yesterday. I think it was like 12:30 at night. Yeah, I'm working again this evening. Alrighty, in New York State, in Orange County, it's the first of two things we'll see for New York today. we do have an update on their COVID cases. But this is an update in regards to measles. In Orange County, New York, 2 babies, too young for vaccine among new measles cases confirmed in Orange County. So New York State adds 2 more measles cases, but it does not stop there. Yeah, take a look at this. Now, I gotta give you a reminder here. There is no official update on the CDC page, but I am seeing oh so many news sources. I'm seeing CNN. I'm seeing, local news stations. I'm seeing a lot of news sources saying that CDC reports over 1,000 measles cases in 2025. That very well could be possible because North Dakota, I don't know if I have that queued up here or not, but North Dakota has essentially gone up to 9 cases now. We're having the updates out of Texas. We've got 2 more cases in New York State. It's very well possible we are over 1,000 cases tomorrow. That CDC page will update tomorrow. And the majority of these cases are Texas. Texas makes up 702 of the cases, but you know what? As the year goes on, yeah, Texas is continuing to rise, but we're starting to see more states come into the mix. We're starting to see more things happen. So that picture could change down the line. Speaking of Texas, whooping cough is a problem. Galveston County whooping cough cases nearly eclipsed the 2024 total, and it looks like they have already confirmed 30 cases. They had 33 cases last year. Mind you, we are only in May. There's a lot of time left to go in this year, so that is already a high number. Yeah, that's not a good thing whatsoever. Alrighty, for those who follow the Novavax vaccine or the company as a whole, hey, their sales have gone up 600% year over year. Now, their vaccine has not been approved by the FDA yet. Will it be? I can't answer that question. They are still in talks, but it seems to me a lot of people have an interest in the Novavax vaccine, and the sales are showing that. Their sales are up 600%. So if you're following Novavax, there you go. Some good news there. This is not good news. Matter of fact, this actually makes me kind of angry. Kelly Ripa says, "It was lovely getting COVID on her favorite Mother's Day yet. I was in forced seclusion." And we're not going to read this whole thing, but basically what she's trying to say was, well, I wasn't being bothered because, I was alone. No one could bother me. Okay. You don't joke about getting COVID. Millions of people around the world have died from COVID. Yeah, get my point here. Millions of people have died from it. You don't joke about it. And it says, yeah, I was forced in seclusion and nobody could get to me. Reba said, it was lovely. No, it's not lovely whatsoever. This happened apparently 2 to 3 years ago. I'm sorry, but that really makes me upset that someone would actually speak of COVID that way. Now moving on to what is kind of turning into a soap opera or just a never-ending story here. Kristaps Porzingis, who plays for the Boston Celtics, who had COVID back when he was playing with the Dallas Mavericks a few years ago, and then had an illness back in February and into March, and guess what? He says he's having good days, he's having bad days. There's just no telling what's going on. Yeah, he's dealing with something. Yeah, he's saying it's not an injury. He's just not feeling himself. He's just not feeling well. And you know what? That is a problem. And I still like to believe, I can't confirm it, I still would like to think he may have long COVID and it's done something to his immune system. It's just not a good thing whatsoever. And you know what? We come across this story directly afterwards. Get this. New research links long COVID to worse health-related quality of life. Let me repeat that. New research links long COVID to worse health-related quality of life. Now, we just talked about Kristaps Porzingis. Does that not sound similar to him saying that he's just not feeling himself whatsoever? Put the two together. We know he's had COVID. And we know he's got something going on now, and it's not making him play as much. The other day he had to exit halfway through a game. So something is clearly up, and, well, it sounds very similar to some of this data from long COVID. Overall, long COVID prevalence of 23%, and there's multiple symptoms being linked to a not so good health, and yeah, it's long COVID. It's just continuing to be an ongoing going problem, and we really need someone from somewhere. I don't know if it will be a political figure or maybe someone speaking out. Kristaps Porzingis, if you really do have long COVID, speak out about it. Maybe you could actually be the one to get the ball rolling, raising some awareness that, hey, we need to get something going here and do something to really help people who have it. I don't know. It's just totally ridiculous that we don't do anything. Alrighty, Mother's Day is coming up this weekend. Please make sure you are masking and testing yourself for COVID if you plan to visit your mother this weekend, especially if you're going to go into a nursing home or long-term care facility. And hey, why not? Why don't we try and make a hashtag going over on X? Mask for Mom or something like that. Maybe it'd be masking for Mom. Let's try that, shall we? Alrighty, moving on now to this. Nothing really major to show you on the website. I did update and add a few things. I'll probably do some more of that tonight and tomorrow. Taking a look here, there are no updates right now from Texas. That next update will be in tomorrow. And here's what I'm seeing for, nope, that's not what we want to see next. We will get to that in a little bit. Here's what I am seeing now for measles. And again, it is still 935 confirmed cases here in the United States. Taking a look at the UK. The UK reports another 1,233 cases. That's up by 5.5%, or 64 cases. Deaths are up by 10. 61 deaths reported. I don't know that that one actually updated. And let's refresh this because I'm waiting to see if the positivity rate updates. And it looks like here the positivity rate is, as of May 2nd, 5.74%. And we can see here, total number of people in the healthcare, 1,005. In Canada, COVID-19 is moderate, flu A is moderate, flu B is moderate, and RSV is moderate at this time. Taking a look at what is going on with bird migration. Why do we look at that? Because we'd like to see what is going on in terms of the potential spread for bird flu. And we do see here that millions of birds, yet again, in migration. Let's see, where did it peak at today? Did it go over 500 million? It did. Wow, it actually went over 600 million. High bird migration traffic all across the country, which could lead to the spread of bird flu. Taking a look at what is going on with air qualities in the United States, and you're going to see a few bad areas. Yeah, the Mid-Atlantic on southward, not doing good today. You can see Mexico and down through Central America, some problems there today with air qualities, and some problems out on the West Coast in California as well. Not as bad in the Pacific Northwest today. Taking a look at what is going on in terms of heat-related illnesses, and I do need to refresh this, we will probably see that there are some out there, mainly minor problems. Probably any significant problems would be down in the southern states. That is, if this ever does load. Yesterday we did see some significant problems. Yeah, there we go. In southern Texas. Yeah, mainly minor problems. A few in the Great Lakes, a few in the Northwest, a few in the South, and some moderate problems down there in southern Texas at this time. Taking a look at what is going on in Pinellas County, Florida, and wow, take a look at all these calls. Let's count how many sick person calls. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, at least 11 unknown problems showing up a lot. And we have been seeing wastewater go up there. We're going to look at that wastewater site again in just a moment. Philadelphia yesterday, another 902 EMS calls. That is a high number. And at one point this morning, Montgomery County, Pennsylvania, did hit, I believe it was around, I could probably actually, you know what, I did do a X post about this. Hang on, I am going to get, yeah, there it is right now. Yeah, I had 25 active EMS calls at one point this morning. That's really bad in Montgomery County. Pennsylvania, slightly better right now. Actually, a lot better. Only 12 right now. Let's see what's going on in Chester County, Pennsylvania. Yeah, we definitely see a few calls going on there. Taking a look at the hospital situation in Pennsylvania, not terrible. There are a few yellow hospitals, again, in southeast Pennsylvania. Overall, not bad today. Taking a look at what's going on in New Jersey, and we do see Cooper University Hospital is full, and looks like that is a divert at this time. And Inspire Medical Center has a specialty issue, and a psychiatric issue is going on at University Hospital at this time. New York State today, 413 people tested positive. I do need to refresh that. That was yesterday. Today is 638, and I do know I refreshed this. Here we go. In the hospital, number continues to drop. 526 people hospitalized, 61 people in the ICU at this time. So good to see that number continuing to drop. We'll take a look at the New Jersey dashboard either tomorrow or at some point during the weekend. We're going to skip that for today. I do want to take a look at wastewater, but before we do that, we do have some numbers from CJS. Let's take a look at that. And we do see Tuesday's numbers. He said Florida's daily number was 290 new COVID cases. New York, 391 new cases. Puerto Rico, daily number, 164 new cases. Maryland, 277 new cases and 8 new deaths. That number came down. Michigan, 814 new cases, 9 new deaths. Virginia, 880 new positive tests and 22 deaths reported by the CDC data tracker last Friday. Their cases came down as well. The Mid-Atlantic region, I think, is dropping at this time. Florida's numbers today, for Wednesday, I should say, was 474 new cases, 1 new death from January of 2024. Figure that one out. New York, 424 new cases. Puerto Rico, 301 new cases. Hawaii, 172 new cases. Nevada, 5 new state-reported deaths. Nevada appears to have reduced their total number of known cases by 1,000 per this week's update. Okay. Oregon, 5 state-reported deaths. And Washington, 244 emergency department visits reported. Alrighty, we need to take a look at wastewater scan for COVID and maybe some other things when we take a look at wastewater sites. COVID is medium in the west, medium in the Midwest, and medium in the Northeast, but low in the South. So let's go take a look at Florida first. St. Petersburg, northwest side. I don't know how this is going to come up. Okay, so it did actually come up correctly. Earlier I was having an issue where everything was like really zoomed out. It wasn't working correctly, but it works now. Remember we were seeing that big rise there? Well, that big rise did happen, but now it is dropping ever so slightly at this time. Still a medium level for COVID there. We're still seeing all of those sick calls. Now we need to go up to Utah because I believe we looked at this the other day. Well, we need to look at it again. Central Salt Lake Valley, Utah. Take a look at this. Yeah, high levels of COVID, and it's continuing to rise there. Like I said, this could get corrected later in the week. Although we just saw Florida get corrected downward, this one is continuing to rise at this time. And it is a big population. 600,000 population. RSV is medium. HMPV is actually rising there as well. So that is concerning to see too. And we also need to take a look at the Midwest because check this out. Look at the Midwest as a whole. Yeah, it's starting to go up ever so slightly for COVID, and that is concerning. And also HMPV continues to rise there as well. That's something we need to continue to watch. HMPV. Northeast region HMPV is dropping. And when we take a look at COVID, COVID is listed in the medium category at this time. Let's go check on New Jersey. How about Oakhurst, New Jersey? Let's see what's going on there. COVID is listed at high. It was dropping. Most recent update went up slightly, but again, you can see here it's could be one of those wonky movements. But nonetheless, it is still listed in the high category at this time. And let's go out to somewhere in the West Coast, shall we? Actually, let's go to South. Can we go to South Dakota? Yankton? Hope I'm saying that correct. Yankton is medium for COVID at this time. RSV is low. Influenza A is low. Influenza B, HMPV, EVD68, norovirus, all low at this time. Alrighty, here's the deal, folks. We are still in a lull here in the United States. Though be it, we're watching Alaska. We're watching Hawaii. Take a look at this. Alaska, yeah, it's still rising ever so slightly. We'll get some new CDC data tomorrow, which will clarify if that was just a 1 week bump or, hey, maybe those areas are still rising. Taiwan, Thailand, rising at this time. We're keeping our eyes over on New Zealand and Australia as well. That NB.1.8.1 variant, that's something we're going to watch. Is that going to be a big deal here in the United States? Hard to say. We're seeing small rises in the UK, not from that LP.8.1. You remember that variant, whatever one that is, and the old XEC variant. That's still the thing in the UK. So we'll have to watch what happens in other countries to see what could potentially happen here in the summertime. Quickly, before we go, we need to take the hydration break. Water is the drink of choice today. Very important to stay hydrated. If you enjoyed today's update, give it a thumbs up, subscribe down below, help me reach 10,000 subscribers, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time. Stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.